This is a hover sling that can be used for turning, cleaning, weighing, and transferring your patients with a weight capacity of 1,000 pounds. Do make note that for patients with low Braden scores that are on low air loss mattresses, you are able to use this. Start by raising the bed to a comfortable working height for both you and your partner. Make sure to lower both side rails down and instruct the patient to bend their knee on the side where you will be inserting the sling. The staff member that will be supporting the patient on the other side will support by the shoulder and the knee, while the other staff inserting the sling will align the sling to the patient's body and to the center of the bed. Make sure to only support the patient, not pull them. Return the patient's body to supine position before you would repeat the steps onto the other side, where you would bend the knee, roll them to the other side, and now unravel the sling. Once done, go ahead and finalize your patient position, raise the side rails of the bed, and lower the bed. To turn or reposition a patient, you may either use a ceiling lift or a Golvo that has a sling bar. Raise the bed to a comfortable working height, making sure to lower the side rails. Once you and your partner agree on the colored loops you will be using, hook the same colored loops to the sling bar at the patient's shoulder and hip, and bend the knee on that same side. Have your turn wedges and pillows ready, while the staff on the receiving side will operate the lift device. The staff member on the receiving side will support the patient's body, not pull, while the other staff will insert the wedges or pillows. Make sure to leave space at the coccyx. Using the lift device, lower the sling in the patient and finalize your patient position, making sure to raise the side rails and lower the bed. The steps for this process will be similar to turning a patient, where you will raise the bed to a comfortable height, bring the sling bar from the Golvo or the ceiling lift to the patient's center body, lower both side rails, and you will hook the same colored loops to that side at the shoulder and the hip, bending the patient's knee and having your cleaning supplies ready while the other staff member will operate the lift device. Place 1 to 2 wedges to maintain the patient's turned position while you're providing peri-care, raising the side rails on the side that the patient is facing if there is no one there to attend to them. Make space to clean your patient, and once done cleaning, insert a new pad, straightening out the sling underneath them. Remove the 1 or 2 wedges and place the patient supine. And once the patient is supine, prepare to turn the patient with the lift device to the other side, having the knee bent. Finish cleaning the patient as needed, remove the old supplies, and unravel the new pad. And then lower the patient with the lift device, raise the side rails, and lower the bed. Using the LECO scale 400 attachment, you are able to weigh your patient. Location depends on which unit you are working on, so ask your A&M if you need to find it. Start with removing the sling bar and attach the scale to the belt. Reattach the sling bar below the scale attachment. After attaching the pieces, press 0 to zero the scale. Once both staff members agree on the chosen loop color, tie the straps together once before hooking onto the sling bar. Ensure the sling bar is centered to the patient's body and held steady while placing the loops onto the hooks. Here we will demonstrate how to tie the loops before hooking onto the sling bar. Once complete, lift the patient up using the lift device. Press the operate button to read the patient's weight, which can be viewed in either pounds or kilograms, keeping in mind that the HoverSling itself weighs 3.5 pounds. Lower the patient using the lift device, raise the side rails, and lower the bed when done. When transferring a patient from gurney to bed or bed to gurney, you may use the Golvo or a ceiling lift. Position the bed at an angle to accommodate for the placement of the gurney, raising the bed to a comfortable working level and having staff next to the patient holding straps to support them. Lower the side rail on the gurney side and position the gurney next to the bed. Ensure both the bed and the gurney are locked and bring the side rail up. Like before, tie the loops once and hook onto the centered sling bar. Remember to have the bar stabilized while placing the same colored loops that are agreed upon onto the hooks. Lift the patient with the lift device. Lower the side rails of the gurney and guide the patient's body to the gurney. Lower the patient with the lift device and raise the side rails, remembering to have someone secure the patient when the rail is down, using the straps. Not pulling, only supporting.